Foundation for Science and Technology, and the support of the University of Spain. And with their support, we have been able to put together this amazing panel of experts who will be moderated by our own Quevedo. These experts and leaders in the field that have volunteered their time to be here with us tonight about their first-hand experience in the field of vaccine development and immunization, and also to tell us about the work that they are doing to achieving the goal of global immunization. Have the presence of Dr. Marina Villegas, who is the director for the State Research Agency for the Spanish government. She holds a PhD in chemistry from the Autonomous University, and she's a staff member for the Spanish National Research Council, where she has held numerous appointments throughout the years, from department head to the director for the and mobility program department. She has also been appointed years later the Deputy Director General for Research Projects for the Ministry of Economy and Competitiveness, and having her new role as Director for the State Research Agency. She was the Director General for the Scientific Research. She's also the president of the Spanish Polar Committee. I'm really grateful that she got our invitation to speak here tonight and to open this event. Thank you all very much for this, and I hope you enjoy this event.
Hello, good evening, night, I don't know, for the time for this evening today. Thank you very much to ECUSA and of course to the Embassy of the State here in Washington for organizing this event. For me it's a real pleasure to be here today, and I would like to say that sadly we have to go quickly to catch our plane to return to come back to Spain, so we have to end quickly after this small short speech. I know that since the establishment of the Association of Spanish Scientists in the United States, very active in organizing seminars and scientific conferences of high interest like this one. This work you make is very important to get a wider scientific culture, which in turn interests society, interest in science. And it also, not only science, but also it's something that you know that it's important everywhere, but particularly now in Spain. In fact, in Spain, the relationship between citizens and research, development, and innovation is luckily becoming increasingly important. Although slowly, we are moving on from the little literacy in science historically shown by our own. So now we are happy that we have room for getting it. The public disclosure of information is an essential element, both to report to society about our job and our challenges, and to allow it to form part of our results and progress. It's very important to society because if they believe in us, they will ask for more science. Thirdly, we call the strengthens image and activity. As an activity, we are both the social involvement in research development and innovation, and contribute to the development of new vocation among the young people, which is another very important people, as we said. We have ahead a wide field for deploying a scientific culture that generates well-informed citizens. ECUSA is carrying out a splendid discussion, working also bringing Spain closer to the Spanish scientists in USA. You, the Spanish scientists abroad, are the key element of and for the Spanish system of science, technology, and innovation. You are the best evidence of the talent in Spain, having a great impact on the image and reputation of our science. Some of you complement your work in this part of the Atlantic with the work you are developing in with cooperation with the Spanish centers, others will return sometime, someone earlier, another later. And this makes you remain fundamental because your talent is a really valuable experience for the Spanish system of research, development, and innovation. Thus, establishing a closer contact with the Spanish scientists abroad is a necessity. We believe really is a necessity. And ECUSA is a very good example in this respect. As a head of the recently State Agency for Research, we are a brand new agency. We are new, very new. We start on June of this year, so we are newer than ECUSA. Please let me quick list you some of the advantages for the Spanish system that will bring the agency. It will enable us, we hope, to move forward to a more flexible and autonomous funding system. By the availability of an ongoing system control, the administrative burden will become reduced, allowing us a greater agility. It will also allow that the programming activity will be independent of the budgetary processes with a multi-annual planning, setting out the objectives to be achieved in the medium term and bringing, hope this is very important for us, bringing stability to the deadlines of the goals for projects of human resources. For the first time, a result-based monitoring funded actions will be established, something barely done in Spain until now. This follow-up will allow us to measure the impact of the investment, as well as to design policies and instruments supported by the evidence of the analyzed data. Finally, it will allow us to register the private funds finance research and development in a simpler and clearer way, as is in the case in other countries around us and not feasible at present. I really hope that the Spanish science may make a leap forward with this agency. It is also my hope that ECUSA keep up this level of activity and carry on doing the things that they have done so far. Thank you very much. Enjoy this evening. I think it's going to be a great evening, but sadly we have to move. I want to thank Anna for this. She has taken care very well of us, so thank you, Anna. Thank you, the embassy, and thank you, ECUSA, for being here. Thank you.
Now, I would like to go to the mic to Luis Quevedo. Luis Quevedo is a journalist and science community experience in moderating the science. This is why we are having here tonight.
Hello. So it's a great pleasure to share with you tonight for, I think, upwards of 60 minutes, so we're going to be lucky. We got plenty of time to enjoy the expert panel that we have here. When we said we opted for a lesser used road, let's say, instead of a classic panel wherein people will be using a lot of slides and presentations, we're going to be slightly more informal, keep it open to dialogue. So the idea is that in order, we'll have 5 interventions, 5 to 10 minutes long, with a little bit of a story and anecdote for one of those. But please feel free to interject, ask questions at any time. That goes well for the panel, of course. And then once we finish that 60-minute mark, we still have another half an hour to just open and enjoy. I know there's wine and nice things to be eaten right outside. We can negotiate later. In any case, it is a real pleasure. Thank you to the Spanish government, ECUSA, of course, and the embassy. It's a real pleasure to be here. Let me start by one thing. I'm not a Windows guy, so this might come across as weird. Mike is going to be opening the panel. Mike, please come up. He's the executive director of the United Nations Foundation. He's going to be giving the first perspective on the vaccine Yes. We do have a video, and I need you to open it. It's here. It's right on the thumb right. Okay, I don't know how to open the thumb right. On a video section. There you go. That was easy. And that's it. You see, let me transfer that's working. This is Dawn. All right. Almost there. You can't be perfect at everything. Yep. Okay. Go. There we go. All right. My name is Mike Beard. I'm the executive director of UN Foundation Advocacy, and I always get very says I'm on an expert panel because that I actually have to live up to being an expert, so to speak. My expertise though is not on the science side like you. It's on telling the story of vaccines, telling the story of why immunization matters to U.S. policymakers. And so through that lens, I hope to give you some insight into the work that I have to go through to be able to tell your story, to be able to make you guys be successful. I'm going to start off with a very quick video because I hope that it illustrates a little bit of the story that I have. What people get out of that right away is this idea of how long and how hard it is to get vaccines into the developing world. The vaccine campaign was actually in Haiti that we shot that video. The amount of energy it takes to get to that last mile, it was a measles campaign, I believe, is extraordinary. And it's extraordinary the pressure it puts on the people that would go out of their way to get this. And that, the people going out of their way, it's, you look at what the pockets of people in the United States that don't want to vaccinate. If you look at research that we have done at the United Nations Foundation, you actually see even within those pockets are agnostic or anti-vaccine, they actually accept that we need to have vaccine delivery in developing countries. And now we can have a whole long conversation about that later. But the other side of this coin, though, that I think that the video was showing, was the amount of energy and work from probably a lot of different agencies to get that vaccine to that village. And that's the story that I want to tell, because as an advocate, I go up to Capitol Hill all the time and I talk to members of Congress about
why it's important to support the UN, why it's important to support measles campaigns. And one time, a few years ago, I was in a lobby day group. And whenever I'm in lobby day groups, we go up with a bunch of us advocates from different corners of the development community. I'm from the United Nations Foundation. There was somebody from the education community. There was somebody from that worked at like Caterpillar or something like that. And they sent us to a bunch of different offices. And the last one, of course, was this really conservative member of Congress's office. And I walk in there and I say, well, Mike Beard, I work for the Better World Campus, our lobbying side of the UN Foundation. And we were talking to his staff a little bit, and then all of a sudden the boss walks in, the member of Congress walks in. And very conservative, but also a border district. And so I grew up in the Mexico border, about 100 miles east of San Diego. Very poor rural area, and so I understand what border regions are like. I knew this guy's different. I knew where he was coming from. And he goes around the room and he says, you know, what do you work on? Well, of course, he pointed at me first, and I said, well, I'm Mike, I work on U.S. issues at the Better World. He's like, well, you know, I campaigned on getting us out of the UN. Okay. This is not a good place to start having a conversation. He is right off the bat saying that his job in life is to actually make my job much harder, which make sure that I get paid, I guess, but that's the only good news that comes out of it. And he said to me, he said, well, and after we go around the room, he said, okay, Better World Campaign, what's the biggest reason? What's your #1 reason for the U.S. to be supporting the UN? And I looked at him and I said, sir, you have a border region district. The U.S. Centers for Disease Control works with PAHO, the Pan American Health Organization, and the World Health Organization on disease detection and prevention. That is keeping your constituents safe, like Ebola, lung diseases like Zika. These sorts of things are absolutely necessary for our national security. I immediately go to national security when I'm concerned about. For our national security, sir, for your constituents. And you know what he said to me? I had no idea that the World Health Organization was a UN agency. And I just looked at him and I'm like, I can't win. Your campaign, and one of the first votes you completely get the U.S. out of the UN, and you're not even accepting that the UN plays a central role in our national security or that affects our people. That's a problem. And so one of the things that I'm here to do, and we'll talk a lot more about today, is we need to be able to spread the word of the vast amount of infrastructure that it takes, the work that you do, to the people who need it the most. And that's the story that I get to tell, and that's what I get to do on a daily basis. So thank you very much. He's still in office. He's still in office.
So you mentioned PAHO. Alba Maria Romero used to be your next speaker. She's representing. Okay. Okay, so please get the mic and we'll open questions later.
Thank you. Thank you, the organizer, for the invitation. It's a pleasure to be here. I am a regional advisor on immunization, working with countries and policy and implementation of immunization programs. It has been a nice experience. That's why I want to share with you something. And then I would like to share, they asked me to tell you a story. And then I said, the best story I can share with you is one fantastic story that is I heard that many of you are aware of the elimination of measles in America. Yeah. This was there was a declaration of this free of measles transmission, and that is a very important public health milestone, because you know the measles is a very severe disease which causes death, and also I would say that it's one of the highest communicable diseases that we know, and the impact of this elimination for the achievement of the NDGs, for example, the Millennium Development Goals, and also the reduction of the infant mortality has been very important. And this is the first disease which is eliminated in the Americas part of it. The first one was smallpox in 1971. The second one was polio in 1994. Syndrome of Rowland syndrome, congenital Rowland syndrome last year, 2015, and this year we have the elimination of this. And this is historic for public health, not only for America, but this has an impact. And maybe you could ask me, how can we have doing this? And I have to say that this declaration here this week is made in the framework of the directive and the representation. We have the representation of all ministers of health from PAHO, from the Americas, including the Minister of Health. And the declaration is made here with them, was established in 1994 with the Minister of Health as well. And that means that we have the political support, the highest political support in countries, because they have the commitment here, they made the commitment here to implement and to align this commitment with resources, with national resources. And that is very important for countries to advance in this implementation. But I will appreciate you that this has been an evolution. The immunization program started 29 years ago with only 6 vaccines, and they are managing now around 20 vaccines. Vaccinating one child was around $5, and now $70 vaccinated one child. And the introduction of new vaccines, and you will see the different, for example, between Europe and America. Many countries have used new vaccines, for example, influenza vaccine territories have introduced the influenza vaccine. 18 countries have introduced HPV vaccine. 19 countries have introduced pneumo vaccine, and others have introduced rotavirus vaccine. But this has been a process, and also with in addition to the commitment of the governments, but the healthcare workers, the ministry of the healthcare workers, is very important. I could say that it's not nice and perfect. We have gaps. We have many important, or many kids or people left behind, and that's why we need to design strategies to reach this population in order to improve coverage, especially in urban areas and worker areas, in order to reduce gaps, in order to give them, to provide vaccine safe and efficacious. And then in that framework, I would like to show you one of the other initiatives that we are very proud of being the region which started the vaccination week. The vaccination week in the Americas started in response to the last endemic outbreak of measles in 2002. I proposed to have an Andean campaign because the outbreak was between Colombia and Venezuela. And then the Minister of Health proposed a campaign, and we tried to maintain this momentum and this proposal, and we were able to involve all countries to have vaccination weeks. This initiative started to have vaccination week until 2012, that we have the World Immunization Week. At this moment, we have more than 180 countries in April, last week of April, conducting campaigns. That means that we have a very high visibility for immunization, political priority, and also mission language. That's the main objectives of vaccination. And then with that, we're going to teach you the opportunity.
60 seconds. Every time.
Vaccination with every year,
Hopefully not.
You do not have to be a bit to go for the vote. When staying healthy is the name of the game, vaccination protects you from one preventable disease. Just as Olympians are committed to winning the gold, we are committed to vaccines are the most cost-effective public health intervention. They are safe, as well as and they save lives. So here today, go for the vote, get vaccinated.
I was trying to say, we have we conducted a campaign Olympics and environment.